thank you so much for having me. So, as Sue said, my name's Nicolette Porter and I'm a midwife based in London. So today I'll be talking to you about supporting autistic women and birthing people in the perinatal period and my research in this area, because it's a group that's often overlooked. So this is an area of both professional and personal interest for me, as a neurodivergent midwife myself. And you can see a picture there of me when I was a student, 19 years old, fresh-faced, my first time wearing my uniform, and I was so proud. But I also, under the surface, faced a lot of challenges, similar to the challenges that Emilie outlined in her excellent presentation. So I experienced social challenges, adjusting to interacting with colleagues and clients and understanding the unspoken hierarchy in a hospital setting, and routine challenges, learning to adjust to a very unpredictable hospital environment, and sensory challenges. The bright lights, the loud noises, the chaotic nature of maternity services often led to quite daily sensory overwhelm. Um, and this experience really sparked my interest in the autistic birth experience because despite all my struggles, I couldn't stop thinking, well, I'm not in the most pain of my life right now. I'm not vulnerable. I'm not in labor. And how must this feel for an autistic birthing person? So that's why I started looking into the experience of autistic birthing individuals from a research perspective. But to really understand the autistic perinatal experience, I think you need to look at the broader context of autism in healthcare, because the evidence does suggest that autistic individuals have unique healthcare needs and that sensory sensitivities can impact their experience in these healthcare settings. Things like their communication difficulties can, or differences can affect patient-provider interactions, and things like routine changes or disruptions, which we know are common in healthcare settings, can be quite challenging and distressing for some autistic patients. Things like anxiety and sensory overload can be quite a common occurrence in medical visits or even leading up to medical visits, meaning that people might be worried to even interact with the services to begin with. So I kind of wanted to see, does this kind of context of autism in healthcare translate over to perinatal care services? So that's kind of why I was interested, because there's a lot of disparities that we know exist in autism and healthcare. Autistic people face significant disparities in healthcare compared to non-autistic people, reporting lower satisfaction with healthcare staff communication and higher odds of unmet service needs relating to their physical health, mental health, and prescription medications. So, as part of my undergraduate dissertation, I did some research as a literature review into this area. Now, I can't go into all of the findings in this segment, but feel free to read a little bit more about what we found in a co-authored article with myself and Emilie, which you'll find in the resources list at the end. But I will pick out some things that I think you might find quite interesting, some themes that emerged from this review. And one major theme that emerged was communication breakdown. Communication difficulties during childbirth, particularly, were noticed, which were linked to things like stress, pain, lack of control, the routine change of it all. And this immense stress could lead to stress-induced shutdowns, where patients felt challenges in verbalizing their experiences. And you can imagine that if you feel it's difficult to verbalize your experiences and your needs, that can compromise things like informed consent. And it's really critical to think about communication breakdown between patient and provider and trying to meet people where they're at, because a lot of the participants in these studies were reporting that not feeling understood by healthcare staff made them want to disengage from these services. And we know it's concerning because missing antenatal appointments can be linked to adverse outcomes. Another key theme that emerged was, quite interestingly, misinterpretation of pain levels. Now, some autistic individuals have different ways of perceiving and expressing pain, and this might be due to interoception differences, causing struggles in interpreting internal bodily sensations. So then this is why some people found it difficult necessarily to express verbally the pain that they were in. And this underscores why we shouldn't just be relying on typical body language or typical expressions or facial expressions to measure the need for things like pain relief. And another significant theme that emerged was judgment from healthcare professionals. And some participants reported feeling, quote, treated like a joke or overruled in their choices. And they described being violated and powerless. And many participants felt judged and stereotyped by health professionals, receiving unwanted attention, not attention in terms of support, but attention from social services or safeguarding, or the assumption that they would be less good mothers. And I really pointed to perinatal mental health here in bold because you got to think, what's the impact of all of these things? And we know that negative experiences can have significant implications on your mental health. And by having birth traumas, these can be caused by psychological distress in this area. And this really does translate to the research because research suggests that autistic women have an increased likelihood of prenatal and postnatal depression, which was found by a study by Pohl et al. In 2020. So, as midwives, we have a responsibility to provide psychologically safe spaces for these women. So it's not all doom and gloom. I did want to give some recommendations that came out of this review. So following the review, I did make some recommendations. This was done back in 2020, so context of the pandemic, but some of them are still very much applicable today. So one of the things we recommended is having that accompanying partner, which you can imagine in the COVID times wasn't always facilitated. And having that accompanying partner can really help to reduce your anxiety and to facilitate advocacy for their birth choices, especially when you have things like stress-induced shutdowns. Having autism awareness training, and also not just awareness, acceptance, because it's really important to have training emphasizing the importance of respecting differences and making those reasonable adjustments. I also recommended the introduction of the role of a specialist autism or neurodivergent midwife. And this is because we need to ensure that needs are being met in this area. And you would have a bereavement specialist midwife, you would have a diabetes specialist midwife. So recognizing that there are health disparities in this area, I think that the introduction of a role like this could be really beneficial to these women. Another recommendation was alternative information formats. Offer alternative ways of receiving information. Leaflets, videos, providing step-to-step instructions, avoiding vague language so that people can go in their own time and listen again to those health information. Things like that. Providing extended time for appointments if they have needs where they need longer time to interpret information, for example. And then the next recommendation was quiet rooms. Consider quiet rooms in labour because some of the participants reported having noise sensitivity, meaning that they could hear the women or the beeps and the buzzes from the equipment next door. So even considering things like soundproof rooms or placing individuals with noise sensitivity at the end of the ward, for example. And I think the key thing here is really just tailoring the environment to meet the individual needs of autistic individuals because no autistic individual is the same. So consider things like a home visit appointment if sensory overload is a concern when they're going to clinic environments, for example. Find out what is most necessary for that individual and tailoring things to support them. Things like continuity of carer came up as a really big recommendation. And that's because if you need that routine, if you need that structure, going through the maternity services with the same person can be really beneficial. And if you have the same person, they can understand those nuanced changes in the way that they're communicating. They might be able to pick up on, oh, they weren't acting like this 2 weeks ago. Is this normal for them? What's normal for that individual? And you can see that a lot of these recommendations are just good midwifery practice. And that's the thing, that universal design benefits everybody, not just autistic individuals, but everybody using our services. And you might be thinking, yeah, well, this is all well and good, Nicolette, but is this really relevant to my practice? And the answer is yes. The evidence suggests that more than 1 in 100 people are autistic, according to the British Medical Association. And in fact, this is a massive underestimate of the true figure, which I'll go into a little bit already, but Emilie already touched on it. And that's about 700,000 people in the UK. And to put this into context, you're just as likely to interact with an autistic person or their family as you within your role as a midwife as you are to experience things like preterm birth before 34 weeks. The incidence of that is about 1 in 100. Or a case of shoulder dystocia is about 1 in 100 to 1 in 150 vaginal births. So comparable numbers, or twice as likely to experience something like birthing identical twins, which is about 1 in every 250 births, right? So we receive extensive training on obstetric complications. I remember shoulder dystocia was drilled into my brain in my OSCEs and things like that. Yet there's no mandatory training as a as a rule of thumb until recently on things like caring for autistic individuals. So I talked a lot about the 1 in 100 statistic, but there are a lot of factors affecting those prevalent statistics that I did want to just briefly touch on, because this is massively underrepresentative of the true figure. A lot of people experience delayed diagnosis because things like stigma still exist and lack of recognition still exist, and also those years-long waiting list. So our most recent statistics in this area suggest that as of September 2024, there's 200,000 people on the autism waiting list in England alone. Yeah, so a lot of people might still not even have access to a diagnosis. However, we have seen a massive increase because of increased recognition recently. So there's been a 20-fold increase in reported autism over the last 30 years. And that's been massively attributed to changes in the diagnostic criteria, which has involved like an amalgamation of a few different conditions under the umbrella of autism. And there's also been increased awareness for diagnosticians to learn about the variety of ways that autism can present, and how some autistic individuals, especially autistic women, may mask some of their autistic traits for increased social acceptance. And that change and that increased recognition has caused a lot more autism diagnoses over the last 10 years or so. So it's not that everyone's autistic nowadays, as I've heard a lot of people say, it's because we've got a lot better at recognizing it. So the key message here in all of these stats that I really wanted to get across to you is that you will care for an autistic person at some point in your midwifery career. You just will. If they've been diagnosed or even if they've not been diagnosed, you will be caring for autistic clients. So as midwives, we have a duty to provide safe, inclusive, and respectful care. But yet, to date, there has been no research in the UK that has explored midwives' knowledge, confidence, and attitudes towards caring for autistic birthing people. So that's where my current research comes in. So my current research, which is called the Unmask Study, addresses exactly that: midwives' knowledge, confidence, and attitudes towards caring for autistic birthing people. So the key aim here is to identify where the specific training needs are. And to do this, I'm conducting an online survey of UK registered midwives. It's just a 10-minute survey, mainly true or false questions, very straightforward to complete. It's completely anonymous. It's received ethics approval from the UCL Ethics Committee, and it's open to all midwives, whether they have personal experience of autism or not. We're wanting to get a really broad range of people answering this survey. So I'd love for as many UK registered midwives to participate as possible. You can scan the QR code on the screen, or you can use the link, which will be in the resources pack at the end. Or you can contact me on social media and I can give you the link. It's plastered all over my social media. The thing with this survey is that at the time of recording, it is open for another week and a half. It closes on the 2nd of March. So if you have a little bit, 10 minutes after the time this hour's finished, if you could just complete the survey, that would be amazing. And it's really important because we're trying to capture a spectrum of views so we can get a comprehensive understanding of what really needs to change in perinatal care services for these women. And it's important to hear it from the voices of midwives. So to gain statistically significant results, we need a sample of about 400 midwives, and 280 people have been kind enough to already do it. So we really appreciate that. That's about 75% of our sample. So thank you so much for everyone who's done it already. But if you haven't, I'd really appreciate if you could complete our survey, because your insights will help to shape future training and policy in this area. And I think that together we can create evidence-based improvements in perinatal care for autistic women and birthing people. So I have my resources at the end. It also has the link on there if you want to complete it. And I'll hand it back to you. I'm happy for any questions. I'd love to continue the conversation in this area.